Okay, Ania, it is 8 o'clock now. Go ahead,
Okay.
please.
Okay, so good evening, everyone, and welcome back to the sixth and final module in the basic course of medical education. This is Omnia. I'm a final year medical student from Baghdad Medical College, and I will be tonight with you with my beautiful team to help organize a session and get you the most benefit out of it. So the session tonight will be about assessment and feedback. And it is an important topic to be discussed, and we saved the best for the last. So we will start off with Dr. Mumtaz Patel. Dr. Mumtaz, the most welcome. She is a consultant nephrologist based at Manchester University. She is a postgraduate associate dean at Health Education England, deputy director for Conduct and Progress at the University of Liverpool, and she is the global vice president for the Royal College of Physicians in London, UK. She's completed a medical education degree in medical education and currently leading on national work on differential attainment and assessment. Most welcome, Dr. Mumtaz, and thank you so much. Much appreciation for your support and help for our mission. And tomorrow we will be having Dr. Sabih Mashhadani. Dr. Sabih is a consultant dermatologist, and he is a member of the medical education unit at Baghdad Medical College. And he's a member of the advisory committee for the National Council for Accreditation of the Medical Schools in Iraq and the director of the assessment in this council. And he is a leader in medical education and quality assurance, to be specific. Most welcome, Dr. Sabih. So again, for our schedule, we will be starting off with Dr. Mumtaz talking about the importance of assessment and feedback, and then for a 15 minutes discussion, 10 minutes break, and then back again for the principles and types of assessment. And finally, we will end up with some activities and your Q's and A's. So before we leave off, we need to lay some ground rules. If you have a question, kindly type it down in the chat box, or you can raise your hand, unmute yourself, and speak up directly to the doctors. And there will be some attendance forms that my colleague Bishara will post in the chat box. Kindly click on them, write your email and your name correctly on them, because they are important for your certificate issues. Again, your name and your email completely right on the attendance forms because they are important for the certificate issues. And finally, don't forget to follow us on our social media. I'll be posting the links in the chat box. We will be happy to have you with us in the Facebook, in the YouTube, or in our email, or in our YouTube channel. Thank you so much, and that's it for me. Please go ahead, Dr. Hilal.
Thank you very much, Omnia, for your elegant introduction. As usual, most welcome with all attendants. We are privileged today to have one of the prominent figure in medical education, Dr. Mumtaz Patel, who participated previously in 2 modules, and this is the 3rd one. Mumtaz Patel is the Vice President for RCP Global, and she is very supportive and encouraging to the Iraqi RCP London Iraq Network project. And we were a successful team in developing a model that, inshallah, will spread to other areas in the region and outside the region as well. We don't want to take Mumtaz's time, but most welcome with all faculty members, professors from the Iraqi Councils for Accreditation Medical Schools, as well as from other medical schools, with other consultants, with other postgraduate trainee, as well as undergraduate medical students. Please, Mumtaz, the floor is yours.
Oh, thank you so much, Dr. Hilal. I will just try and share my screen. Just give me 1 second. Does that come okay? I will just make it bigger. 1 second. Okay, is that all right?
Yeah, it's very apparent. Thank you.
Perfect. Okay, and that's moving okay when I say that. Yeah, perfect. Okay, so thank you so much, Hilal, and the team, and Omnia, and all the students and our members from our RCP Iraq network. Welcome, and it gives me great pleasure from starting our course to now being on the last module. I don't know where the time has gone. It seems to have gone very quickly. So thank you for the welcome. As Hilal's introduced me, I'm going to talk through around the principles around assessment and feedback. And the evening is split into this kind of schedule, although there is some fluidity, and depending on how long our discussion and things take, the times may change a little bit, but I'll make sure that there is a break in between and then another discussion after the break as well. So this is the outline of the program, followed initially with the discussion around the importance of assessment and feedback, a little discussion break, and then hopefully I'll cover principles and types of assessment as well. So my learning objectives for the evening today is that I'm hoping by the end of this session, participants should be able to understand the importance of assessment and feedback, identify and use the different assessment methods, understand how to give feedback effectively, learn and apply different feedback models, and use a framework to improve the quality of assessment and feedback as well. So this just shows the journey, I guess a little bit of the journey as we're going through as well through the course of our medical education module. So, kind of at the bottom, a student or a trainee going through their learning development with probably multiple levels of assessment through their journey. The assessment could be in different types, which we'll go through, and then the feedback thereafter. And I'm a big believer that the assessment tools should be driving your learning, and then you should be getting constructive feedback, which will drive your learning even further and hopefully allow you to progress to the next stage of your training. So starting off with some definitions. So what is assessment? I guess in the context of professional practice, as you're all training to be doctors, and those who are doctors as well are progressing onto postgraduate kind of exams and training as well. So the definitions can be in different there's multiple definitions, but in the context of professional practice, it's described as a systematic procedure for measuring a student trainee level of progress, a level of achievement against defined criteria. Now that's really important. There needs to be a standard to measure against. And that then allows to make a judgment about a student or a trainee. In the UK, we have the GMC, the General Medical Council, who are our regulator, and they set our standards here in the UK. And I'm sure in Iraq, you have your own system as well. Another way of looking at it is to check that learning is taking place, because we're all teaching, we're all learning. One could argue that, is there exams and other assessment methods necessary? But it is an important tool to look at where learning is taking place. And it's also about getting to know our students and trainees and their learning that's happening. So very important in different contexts. So the other things to consider is then why do we assess? So again, in the context of professional practice, it's all around patient safety and standards of care. So we need to ensure that we are training correctly. We need to align with the curricula. We need to assure the public that we are training doctors and you as medical students adequately to then qualify as a doctor to meet those standards. It supports the development of students and trainees, and it provides evidence when dealing with underperforming trainees or the underperforming student as well. And then when you go through kind of the different aspects of it, what I want you to kind of consider, and I won't do this as an activity just now, otherwise it will break the flow. And I can see that many people of you have joined today. But when we come to our discussion, what I want you to consider is what methods of assessment were used for yourself, both as an undergraduate student, what kind of assessment methods are there? And certainly for those who are more experienced as well, what kind of methods of assessments were used when you were medical students and postgraduate trainees? What was good about them? What's bad about them? What's changed? And I'll tell you a little bit about my own experiences as a medical student and then as a junior doctor as well. And then in comparison, what different methods are used today? Are they fairer? Are they better than previous as well? So the traditional methods. So I trained in Manchester, was my medical school in the UK. And in my sort of days of training in the 90s, showing my age now, we had the traditional methods of assessment. We had knowledge assessment with long essays, short essays, multiple choice questions. Our professional knowledge was tested with long and short cases and clinical reasoning questions as well. So certainly in my sort of exams, we had a mixture of in long cases, short cases, which were assessed. The professional skills which were assessed were around history taking, examination skills, and then the technical procedures were very much see one, do one. So I'm a renal consultant by trade, as I've mentioned, and even things like central lines was, you've seen one, you can try one, we may supervise you, or you can just get on and do one. There was a lot of the assessments I'll talk about later, certainly those weren't in place when I was training. And then this is question about professional socialization, because as we all know, a good doctor is not all about just knowledge and skills. Yes, knowledge and skills are important, but certainly the wider professional skills, the attitudes, the behaviors, the communication skills, those things, how do we assess those? And many times it was based on just holistic judgments or an opinion. So even in my training, I used to have like a supervisor who would just make an opinion about his thoughts, and there'd be a report, and that's it. In a year, that would be as much as I'd probably get as an assessment tool as well. So is that good? Is that not so good? But my feeling is that many of those kind of methods of assessment tested knowledge only, not application. So I still remember my first year exams in anatomy, and literally it was just saying, you know, kind of list the anatomy of whatever, an organ. And it was just, you could very much just regurgitate your textbook, and that was it. That's all you did. And if you memorized it, or if you remembered well, you'd get 100%, but didn't test application. And then when I got to my clinical years, despite getting distinctions or whatever in anatomy, you think, oh, how does that fit in? You know, you don't understand and you can't put the context into it. And many times it was very subjective. All after the exams that I did was opinion of a few people. So even my MRCP exams, I'll never forget the clinical exams. I went to Scotland, like some of you might have done as well. And literally 2 examiners just taking you to multiple cases. Unlike today, not standardized in any way. And it was very much based on the opinion of a few people. So it lacked standardization. It was inconsistent, certainly in my view. And I didn't think that the curriculum was systematically examined. So even as a SHO kind of medical sort of trainee, core medical trainee, very little was examined in that way. And then you just had your pure exams at the end. So historically, if you look at the evidence, the subjective holistic judgments were very much based on the apprenticeship model with poor measuring qualities, as I've described to you just now. So I qualified in 1996, so again, showing my age. So a lot of it was very much subjective holistic judgments. And the very many changes in postgraduate medical education with the more competency-based training came with the modernizing medical career early in the 2000s. I was a registrar then, and I remember the portfolio coming out, a lot of changes coming in, and the competency-based framework coming into play. And that required those newer methods of assessment for clinical competence and performance. And this led to the introduction of many of the workplace-based assessments that we do here. And I'd be very interested to hear in the discussion what kind of assessment tools you have there in the UK, both in the undergraduate setting, but also in the postgraduate setting as well. So that kind of rationale. So what's the rationale around these workplace-based assessments? Are they any good? And we'll talk through that later in the second half of the talk. But the rationale around it was that if there's a competency-based curriculum, that requires confirmation that competencies have been met. So it's basically aligned to curriculum competencies and then ticking off that each things are met during the different stages of postgraduate training. And it demonstrates adequate progression to completion of training. So here we get a certificate of training. So that's what I got in renal medicine and general medicine back in 2006, and that's your CCT. And there's this increased societal demand for monitoring and quality assurance for regulation. And this is really important to measure against, quality of care. So high quality of training leads to high quality of patient care. Lots of evidence around that. So we need to get this right. And the introduction of around the workplace-based assessment provided that opportunity for learning and feedback to be given in a timely way. And that wider quality assurance mechanism was there both for trainees, but also for patients as well. So when you go on to what are we looking for in assessment methods? So any assessment needs to have a clear purpose. it needs to be fair, it needs to be related to the fact that learning has taken place. And it should test what's assessed rather than what's easy to assess. And it should help to improve performance if it's formative, and it should be reliable enough to tease out whether it's a pass from a fail if it's a summative assessment. And it should be multifaceted. I never think one assessment tool is enough. It needs to be a series of assessment tools at different stages of training, both in the undergraduate level, but also in the postgraduate level, to ensure that training is sufficient, is of high quality as well. And all these things have to be very reliable, otherwise there's not much point of doing these things, and there needs to be that quality assurance with these things as well. And then the different types of assessment as well. So you've got your summative assessment when you look at the terminology, that's more your pass-fail things. A hurdle has to be crossed in order to go to that. And it's a high stake normally exam. So for example, the membership, the MRCP exam is a high stake summative exam, which you need to pass or fail. You can have an opportunity of feedback. And I think we're getting better, even with the postgraduate exams, in giving feedback as well. And then the formative assessment tools, which is where these things should be driving learning, because we should be giving feedback to trainees and trainers on their progress to drive that learning, to drive that quality of their training as well. And when you look at the different assessment tools, there's a whole range of them, isn't there, which I'll go through. But in essence, you need to test the knowledge. That's important, and that's your knowledge-based assessments, mainly things like your exams, your MCQs, and then your procedural skills need to be tested as well. And then those wider history, clinical skills tests, which we kind of do in our OSCE exams and things. But then you have a number of assessment tools now, certainly in postgraduate training, which looks at your teaching skills, the wider generic professional skills as well, which is so important, like communication, like leadership, like teamwork. Certainly when I was training, I remember as an undergraduate medical student in Manchester, I had one session on communication skills teaching, just one afternoon in which we were breaking bad news. And then the rest of it was just picked up in the kind of apprentice kind of model when you're on the wards and things. So these things need to be taught, but also need to be tested as well. And then the kind of the Miller's pyramid of learning, as I'm sure you all know. So there's different ways of you're showing somebody at the different levels of competence going up. So the knows how, the going up around the things, and the workplace-based assessments sit at the top of these tools. So they're right at the top. So the lower ones are testing more cognitive skills, your kind of more knowledge and, kind of more your skill side of things. And then the higher levels of learning are testing, sort of more of your professional skills as well. So your knows are around your multiple choice questions, your knows how is more of your structured questions, like your part 2, part 1 written for your postgraduate examinations as well. And then the upper limits of your Miller's pyramid is where your behavioral and the wider professional skills are being tested. And that could be tested both for your objective structured clinical exams, your OSCEs. For example, even the PACES station I was examining for PACES last week is done in that kind of station structured way as well. And then right at the top is your workplace-based assessments. At top of the Miller's pyramid, supposed to test, kind of the wider, kind of professional practice in practice as well. So certainly that's how it sits, and that's your kind of test of or level of competence framework. So when you look at the different bits, you've got your competency-based assessments, which are measures doctors can do in a controlled representation of professional practice. And then you've got your performance-based assessment, which measures what doctors do in their professional practice. And the top bits are more like your workplace-based assessments. And then the lower bits are more like, for example, your OSCEs and your PACES exams and things like that. And in any assessment tool, there's so many of them, but unless there's an effective feedback mechanism, that is the key to the success of any assessment method. So I've sat on so many assessment committees over the years, and you can say, okay, this isn't good, this assessment tool isn't good, we need a new one. But I think if you don't use them properly, that's half the battle. The utility of it, which we'll talk about also in the second half, how you use it, how you feedback, is the key to the success of an assessment tool. So when you look at our kind of the model of assessment and learning, what happens where? So there's different forms of assessment, as I've mentioned. There's the feedback side of things, which is, very, very important. And then the feedback should be driving, kind of insight building, opening out what you understand, where the gaps are. And then that should be driving learning. There should be action planning along the way with targeted feedback, targeted action plan with a personal development plan to then enable you to prepare for your next assessment and then drive that feedback loop in that way. And what is the importance of feedback? Why is feedback needed to be done? So the aim of feedback, I feel, most importantly, as well as many other things, is to promote insight. It's not to judge, it's not to offer quick solutions, it's aiming to promote that insight to then drive learning to hopefully meet the end goal. And if you don't have insight, I mean, I always say that the trainees or the students I struggle with most is when they don't have that insight into their own limitations. And that's when I find that it's really hard to resolve difficulties. There's ways of getting around insight, and we can talk about that in our discussion as well. But I think that's, something that's really important, to promote that insight in a supportive, in a constructive way. No shouting, no telling off, just in a very supported way to try and drive that learning as well. And then I've put up do's and don'ts of feedback. Again, I'm sure we can all give examples where we've had feedback given to us, which has been supportive and constructive. And I'm sure, again, we can have lots of examples between us in which it's not been like that at all. So what's the do's and what's the don'ts? So in my mind, there's lots of different things. Sorry, there you go. So if you are giving feedback, I always say try and do it close to the observation. Make sure that it's done in the right place. Normally it happens in a corridor in our hospital. And, even yesterday when I was seeing one of my junior doctors, he was really upset about one of the consultants speaking to him in a way which wasn't constructive at all. So again, yes, do it close to the observation, but in the right time, in the right setting as well. And always describe behavior very specifically. It's not about a personality contest. Again, I've had a number of people who'd say, kind of somebody was really critical and he, kind of was judging, and it's trying to avoid that and be very specific and only commenting on what you can see, not giving generalized comments as well. And I think things like if you are going to give feedback, which is, kind of not so positive, give examples of why that was the case, what was good, why, what wasn't so good and why. And then not just leave them with that feedback. It's important to suggest areas of improvement. So, how are we expected to somebody to just go away and say, well, that was rubbish? You need to kind of explain to them the reasons why that could be improved and how. And also trying to give follow-up actions for development. So there's no point telling someone, sort of either something positive or negative, but not having follow-up actions to develop and follow through. So those things are important as well. So on the opposite side then is, not avoiding being vague, avoiding being, kind of breaking confidentiality, generalizing, and certainly never judge a person as well, because you can break that rapport with that individual. And if you break that trust with that individual, they're not going to take things sort of seriously, or it may be upsetting and damaging. So feedback can be damaging. And obviously we want to avoid that when we're trying to support our students and our trainees. So the purpose of feedback. So I feel in my own mind that it allows individuals to identify what they've done wrong, what they've done, and how they can do it effectively. You can give suggestions about alternative approaches to improve their effectiveness. It allows the learner to identify the ongoing learning needs. And it should be both challenging and also supportive. So, kind of, I think saying good things for the sake of some good things is not always the best approach, because then I don't think people learn so much from them. So I think sometimes when it is necessary, you can challenge, but support in equal measures as well. So giving constructive feedback, what do you say? How do you say it? And does it make a difference? And again, a lot of this is how we say it and what we say and how we follow it through. And I think definitely it makes a difference. Certainly sort of the students and trainees I've supported over the years, if you get it right, I'm sure you yourselves as senior sort of consultants, trainers have seen when constructive feedback has worked and has made a difference as well. So I think, again, there's different models of feedback, which I'll talk through in a minute. But again, the usual kind of one is always starting with the positives, but it's trying to see and get to see the insight check. So how much do they understand? What do they feel have things going wrong? If somebody asks me about if I'm sat in as a student or as a trainee, I only see the negatives. So you do so many things positively, but you'll always come away thinking, oh, I could have done this better, or I could have done that better. And it's sometimes, it's seen in a kind of slightly negative way. But I think, kind of focusing on the positives, giving examples of what was good, and then going on to what could be improved and how. So again, being very specific of, well, I noticed you were doing it this way, and perhaps you could consider doing it this way, and again, giving specific examples. And the whole purpose of feedback is kind of getting that reflection going. You want to kind of get that insight check, and then you want to see where's the gap between the current versus the desired performance. And then it's agreeing a plan of how you want to achieve that to support the individual to get to that. And some simple guidelines for giving feedback. Again, you're all experienced. I don't need to tell you all of these things, but certainly if it's helpful, I think choosing the right time and environment is really important. Making sure your feedback comments are very clear with specific examples, describing behavior, not personality. I remember a very difficult consultant encounter between two consultants, and I was there just to observe as well as support one of the consultants there. And I remember the consultant turning around to say, well, what do you want me to do? Change my personality? I can't do that. So I think it's really hard when you're being, sort of too picky around behavior, but I think there are ways to describe it. And feedback, if it's all anonymous or you don't have any feedback, how can you give that feedback back? If you kind of say, well, some people have said, but they don't want to be named, it's really hard to make change. Or if it's not written, it's difficult to kind of share that with individuals as well. And concentrate on what can be changed. There's some things that can't be changed, we all know that, but trying to be very specific to support and strategies for performance improvement as well. So the different models of feedback, which I'll present here. So I think Pendleton, I'll go on to in a minute, everybody knows about that one. But the BOOST model is one of the ones we support quite a lot in the sense of it's a much more balanced approach, and it goes on strengths and weaknesses, and it opens out that discussion, which allows that insight development and looking at what you can do differently as well. It's very much observed feedback based on evidence. It's objective behavior, not personality. It's so important to try and get that right. Very specific with examples, with a plan for future action as well. And it's timely in the sense of it's not left too long to give that feedback, but consider the when it is appropriate as well. Of course, in an immediate, urgent, kind of pressured setting, it may be better to let things calm down before you went to give that feedback as well and have that discussion, but timely as best as you can within the situation. And then when you look at other methods, so you've got your Pendleton, which I suspect you all know, and it clarifies matters of fact, making criticism positive, specific, and behavioral. And it's that usual trainee leads on what went well, assessor discusses what went well, the trainee identifies what they could have done differently, and it goes in that kind of stepwise way. But sometimes that sandwich feedback, as we call it, you're always waiting for what's gone wrong. Certainly when I've had this tested on me, you're kind of thinking, what's going to come next? What are they going to say afterwards as well? And I think the recommendations for change and discussing how those improvements can be made is the most important aspect of feedback. And then receiving feedback, I think as I've given examples as I've gone along, it's important to consider that there's listening skills and then there's the challenging skills and what kind of categories can be used. So there's the confronting, cathartic or catalytic styles, which are more categorized around the active listening sides. And then you've got your challenging skills as well, which are some of the others as well. And I think sometimes it's a balance between different things that you can use. And depending on the context as well, you can use different kind of mix of skills, which could be both actively listening to what the problems are, but then challenging, but supporting at the same time as well. And some listening and challenging skills, I think it's all around keys to good listening. So you want to show that you care, you want to be genuine, you want to be authentic and be aware of the other person's feelings as well. But I think using those open questionings and clarifying and summarizing helps that. But if you're interrupting, jumping to conclusions, being judgmental, interrogating or imposing your own beliefs, then of course those things are not going to lead to a constructive discussion. And then that conscious competence learning model. So you want people to get in that level of confidence that they're going up the triangle, so to speak. So a level of unconscious incompetence, what I don't know, I don't know. So that's trying to be supported along the way. And then the conscious incompetence, I know what I don't know, but I know what I need to work on. And then you get to the stage of conscious competence, I know everything, which I don't think anybody does. But then you get to the stage where there's bits that you do in automatic pilot mode that you just keep on going. And it's kind of the level of competence as well as confidence, which is making you go up that triangle as well. And these are the kind of questions which would be important when you're giving feedback as well. So similar to the Pendleton model, this is like consciousness versus competence. What do you think went well and how? So that's that conscious competence. And then when you're looking at unconscious competence, I think you did well in this, but you could do this differently. And then what could you improve, as well as this is really bad when they really don't know. I think you could improve in this and they just don't know what's happening, but you can be constructive in that feedback as well. Okay. So promoting student trainee ownership of feedback is really important. And particularly when we're struggling with, some trainees, it's important that they take ownership of their own learning as well. So encouraging students to self-assess prior to receiving external feedback. So many of the assessment tools I'll talk about later, you have to self-assess against what you are assessed against. And I always say that the trainees who are high flyers are doing really well will always underestimate, or many times will underestimate themselves compared to what they are assessed against. I think giving feedback in small but digestible quantities is really important, and allowing that student to respond to the feedback. So giving a bit of feedback, responding, seeing what they feel about it, getting them to reflect, and ensure that it's a student or trainee driven process. There's no point us just giving all the feedback and the individual not even responding in a positive way thereafter. And I think when you're talking about kind of feedback, again, being specific about deadlines, examples supported by evidence, and it's converted into an action plan. So you're not leaving them just without knowing exactly what they need to be doing. And lastly, for this session, I just wanted to talk about personal development plans. So it's something that certainly I've developed over time and I've got better with, but it's a written document identifying key learning objectives. So I think when you give feedback, it needs to be followed through with personal or SMART objectives, and making sure that they know how they will be met. Includes sort of timing of when they will be reviewed. And that plan should be regularly discussed with the students and the trainees as well. And writing objectives should be, in the SMART way, as we call it, so specific, measurable, achievable, relevant, and time-bound. Very, very important. So there's no point setting people up for failure and giving them tasks which are not going to be achievable. So it's really important that things are done in a measured way as well. So for example, if you're setting an objective around improving key aspects of communication skills, so that's a task that they need to do, but how can we make that SMART? So for example, kind of for appraisals that you may do with your students or your trainees, you can say that by the time of your next appraisal, we'll be making sure that in a variety of settings, you've tested communication skills, and the skills will be confirmed by a MiniCEX, which is one of the workplace-based assessments. So it's very clear with regards to timing, as well as kind of a specific way for assessment, as well as making it realistic and timely as well. And then again, sort of similar goals to achieve. So you've got a clear objective, you've got steps laid out there quite clearly for your students and your trainees, and you've got timelines which people can meet against as well. So all these things are really important to drive the discussion, but also ensure the success of the learning from the assessment tools as well. And that feeding forward, so this points what we're always trying to do with any assessment tool and feedback, is that we want individuals to improve, we want them to develop, and it translates into an action plan for the individual students to drive their learning as well. So I hope that's been helpful. What I was hoping that we could discuss is, before I go on to the next bit, which will be around the different types of assessment, and particularly with a focus on workplace-based assessment, I've put down a few pointers for our discussion here as well, around competence and performance, around sharing your experience when feedback has worked well, but also the challenges of giving feedback. And are these models helpful or not? And again, just sharing your experiences of assessment and feedback in this context as well. So I'll pause here and I'll open out for discussion. Otherwise, I end up doing all the talking, which is not always very good. Thank you. Over to you, Hilal or Umnia.
Thank you very much, dear Mumtaz. Really very enjoyable presentation, as if I am hearing a very beautiful song. Thank you very much, Mumtaz. Can you end sharing, please? And Umnia, can you take the role, please?
Thank you so much. Thank you so much, Dr. Mumtaz, for the beautiful presentation. Okay, so dear participants, if you want to enter the discussion, kindly, you can write in the chat box, or you can raise your hand and unmute yourself and speak directly.
Okay, Umnia, if you allow me.
Okay, please go ahead, Dr. Hilal.
Thank you again, Mumtaz. Mumtaz, if we talk about practicality of the issue of giving feedback, in your practice, when you have an OSCE exam, or even in the PACES examination, probably the PACES is simpler and feasible. But during the PACES, especially when you have a large number of undergraduate students doing these OSCEs, how do you find the time to give feedback, especially individually? And it should be in a suitable environment, in the proper time, and it should be close to the time of the OSCE examination. Can you elaborate more on your practice, current to practice, Mumtaz?
Yeah, no, of course. So here in Manchester, I do the OSCEs we'll talk about the undergraduates first. So the OSCE exams, we have formative exams in year 3. And then we have the summative exams later in year 3 and also into year 4. Now, the formative OSCEs, we give feedback by station. So we would allow a longer station time. So they would do the examination or the history taking skill. And then the examiner would give immediate feedback to the student. And I think that's really helpful. So we have a whole exam, which is literally just formative for the year 3 students, which they really value, because it's the first time many of them have done any of this kind of OSCE station exams as well. And then when we do the formative one for later in year 3 as well as into year 4, then the feedback there is obviously they will get their results and things, and then there will be feedback. But we collate it sort of from all the examiners, and then the supervisor of those students will go through the feedback with them. So they would get their results within a couple of sort of weeks, and then we would give the feedback thereafter. So I think when it's more of a summative exam, until the results are out, it's difficult to obviously share the feedback, but it would be soon after with them. And the supervisor, so I supervise a lot of the students as well as the junior doctors, and then you would go through the targeted feedback with them.
So during summative examination, you will give feedback also individually immediately after the examination.
So not immediately after, just because we wouldn't know what the results and what the marking had been. So it wouldn't be as constructive. But for the formative ones, you would give immediate feedback. And then the summative ones would be a few weeks later once the results have come out.
Few weeks?
Yes.
Thank you. Thank you very much. Okay, Omnia, go ahead. Dr. Muhammad Umar, please. You are muted. Okay.
Thank you very much, Professor Hilal. Thank you very much, Professor Patel, for this nice presentation. And really, it is a very critical to me and my colleague, because learning without assessment and feedback is mean nothing, because you don't know what you had done. It is the new method of assessment like OSCE and others PACE are a bit new for our generation. That's why we have a problem with the new integrated system that assessing by OSCE need a large number of evaluator or assessment. For example, once we have, for example, examining 80 students with OSCE in hospital, imagine how many rooms do you need and how many
Dr. Muhammad? I think there is a problem in the internet, Dr. Ahmed. We can go directly to Dr. Muhammad Saeed. Dr. Muhammad Saeed, please go. Okay.
I think Muhammad Amr. Okay.
Alaykum salam. Go ahead, please.
Me, Dr. Muhammad Saeed.
Yes.
Assalamu alaikum. Thank you very much, Dr. Hilal, and thank you very much, Dr. Patel, for this nice presentation. What we did, just our experience with the feedback after OSCE, after summative OSCE, we asked the student to stay after they complete the OSCE. We bring them again to the same hall, and then we ask our colleague, the assessors, the assessors, those who are they are happy to give feedback, they are ready to feedback. Yeah, you know, some of the assessors, they want to return back to their duty or home. Then the few of us, maybe 5 or more, we return back to the hall and we stand in front of the student and we start to feedback them about the stations, and we receive a feedback from them. And I think this is very, very, very useful, because many professional issues can be highlighted, like thanking the patient at the end, like the way the student, they start, when they talk with the patient, sometimes they talk in a mechanical way. It's not as like we do it in real life. So a lot of feedback, I found it very useful for the assessors when they collect these informations and they return to the student at the end is very useful. And my questions to Dr. Patel is about workplace-based assessment. To me, what I understand from it is not although it is assessment, but it seemed to be, it is a learning opportunity, because there's no mark. There's agreement between the learner and the teacher and the tutor how the personal development plan will be in the future. Thank you very much.
Thank you, that's really helpful. So I think, you know, the way you've described it, the formative OSCEs that we do is, you know, very much like that. So literally station by station, and then a group feedback thereafter. And then when they have the end of year summative exams, the feedback element loop to that is slightly different, because we wait for the results to come through and then we give targeted feedback. But I think going back to also Mohammed Omar's point as well, it is difficult to arrange, isn't it? And it's like a mini operation in the hospital that happens, you know, when it's being run, because we do it in either outpatients or we have an undergraduate center now, certainly in my hospital and many other hospitals now, which is away from the clinical areas. And then we have lots of, you know, kind of little mini rooms and areas where you can just draw the curtain round. And then we have different cycles going on in different sides. But it does require a lot of coordination, doesn't it? So going back to when I was examined, where a couple of examiners just took me around a few patients, and that was my exam done. Not very standardized, but it was probably easier to arrange, but maybe not as valid as some of these things now.
Thank you, Mumtaz. Going back to Dr. Mohammed Omar, because the internet was interrupted, but kindly, in a brief, Dr. Mohammed, as we have many questions for Dr. Mumtaz. Go ahead, Mohammed.
Thank you very much. My question regarding the formative and summative exam for Professor Patel. You know, at the end of blocks of our students, usually from the 4th year up, there is a formative exam at the end of the block and then the summative at the end of the year. Because the formative has no mark, some students will not attend. So I suggest to the deanery of my colleagues to have, even if a small mark on the formative exam, to be evaluated. They say the system, the new integrated system, does not allow that. I like to have your opinion. I think the system is good, but we can do some modification according to our student to make them, you know, the student pay attention for the passing mark. This is the main priority. Of course, they want to learn, but the passing mark is very critical for them. Thank you.
Yeah, no, that's really important. And it's funny, isn't it, when we try and organize all these things to drive their learning, and if they don't attend, it's really quite bad, isn't it? So what we do is we still have the formative exams, but we say it's mandatory that they have to attend. Although they're not going to get a mark, they would get like either a reprimand or a letter from the dean to say, why didn't you attend? If they didn't attend, and then they would have to have a meeting with, you know, myself as a director of conduct to say that we've organized. And because it takes so much time, as you were saying before, we go to so much trouble to organize these things to drive and help our students. And if they don't attend, we class that as a professionalism issue. So we firstly mandate it and say you have to attend. And if you're unable to attend, you have to give us a valid reason, as in sickness or whatever. And then if they just miss it without any reason, then they would need to have a meeting and we would class that as a sort of a professionalism issue. So I think that's how we've done it. We wouldn't put a mark to it, just as you said, that because it messes up the system, doesn't it? If you're then putting marks to a formative exams, it can disrupt the wider system as well. But I think if you mandate it with, you know, kind of a notion that this is unprofessional if you don't attend something that we are arranging to help you, then that's how we've managed to, you know, kind of keep the students there. Because all the stations don't even work, isn't it? If you have 50–60% attendance for a formative exam, all the stations get mixed up in running. So it creates a lot of hassle for everyone who's organizing these things. So that's how we've got around it. And we get near, probably still not 100%, but close enough.
Thank you.
Thank you, Mumtaz. Dr. Nazar Haddad from Basra. Dr. Nazar, go ahead in a brief, please.
Yes, thank you very much, Dr. Hilal, and thank you very much, Professor Battles, for the nice presentation. I have a short questions about the rule of feedback in theoretical exam, not only the practical exam. Is there a rule, and how to deal with a large number of the student in the theoretical exam? If it is applicable, will we generalize it or not? Thank you very much.
No, again, I think for the, as you say, so the practical exams, the OSCEs and things we can deal with separately, and same with the postgraduate exams. But the written exams, I think, you know, you set the standard and your sort of the marking scheme. But if you find that, you know, there's many more that have failed it or something, then, you know, kind of within our quality assurance frameworks, you could kind of argue, is this just kind of too hard or whatnot? But the feedback to those students, we all of the students would have a tutor or a supervisor, and then we have an academic advisor. So for placements, they have a supervisor, and then they have an academic advisor. So what we would encourage them to do after their progress tests or written tests, particularly if either they've not done so well or they want to hear what's happened, we would give them an option for feedback. So it wouldn't be for everyone, just because, as you say, even in our medical school, we have 300 students per year, so 1,500, 1,800 students, too many to try and give individual feedback to. But the ones at request, we would give feedback to, and certainly the ones that we're worried about, we would offer appointments and meetings for them.
Thank you, Mumtaz. Dr. Ali Mansour, go ahead, please. You are mute, Dr. Ali.
Yes, okay. Thank you very much, Prof. Hilal. Thank you very much, Dr. Mumtaz, for this nice presentation. I'm Dr. Ali Mansour from College of Medicine, University of Karbala. I have one question about the assessment of the affective aspect of the student skills, saying professionalism, attitude, behavioral change, and so on. We still have a gap in this aspect of assessment. If Dr. Mumtaz gives few notes about this side of assessment. Thank you very much.
Oh, thank you so much. So that was, I'll talk about it more in the second half as well, but assessment of professionalism was probably one of my things that I did for my thesis, for my master's, because I think, as you say, it's so hard to assess and so hard to record as well. So in the UK now, all of our undergraduate students will have a portfolio, and very much like the assessments day to day, the workplace-based assessments that I'll talk about afterwards as well. So if there's attitudinal problems, professional behavior problems and things, those would get picked up with the placements. And also we have areas where we measure professionalism. So for example, like the Mohammed Omar was saying, and if others are not attending exams, or if they have got attendance issues, if they've got behavioral issues, we have ways of recording certainly lapses in professional judgment as well. So it is very tricky, and I think it's hard to do. But in clinical placements, we would have workplace-based kind of assessments in which professionalism would be evaluated within that as well. And professional behavior attitudes would be assessed with knowledge and skills. And also we have things like multi-source feedback. So for each placement, the supervisor can, or many of them, particularly towards the latter years of medical student training, will get feedback from the nurses, from the other doctors that they work from, anonymous feedback, which will come in their portfolio. And that will give us an evaluation of professional behavior. Because as we all know, the professional behaviors, if we can address them early, they will reduce the chance of those trainees or students progressing to get further problems in later career. So earlier identification is the key. And I think many of the workplace-based kind of assessments will pick those things up. The exams per se doesn't pick it up, but also like from the OSCEs, you might pick up severe communication difficulties, somebody who's really rude to the patient or something. So sometimes even in the summative exams, you might pick things up, but it's mainly from placements and other things. But all of the domains of assessment for workplace-based assessment should assess professional behavior. I hope that helps. And another thing for you to think about when you're developing your assessment tools within your medical school as well as your postgraduate setting.
Thank you very much, Mumtaz. Dr. Ahmed Hashim, go please. Dr. Ahmed Hashim.
Yes, thank you very much, Dr. Hilal and Dr. Mumtaz, for this very interesting and very important subject you have told about. I want to comment about one thing about one of the tools. I want to share experience in the University of Karbala College of Medicine. We are using now the mini CX for a workplace-based assessment. It's a very powerful tool. And the good thing about this tool is that it has the criteria or the property of immediate feedback. It's on the in the ward, you will examine the student, and then you will give him an immediate feedback. It is very powerful tool. It's very interesting, and I think we should start to incorporate the ward and workplace assessment in our assessment. This is what I want to say. Thank you very much for it.
Well, thank you so much. And Hashim, I'll be talking about workplace-based assessments very much so in the second half, but the mini-KEX tool, as well as many of the other workplace-based assessment tools, are really, really good in the sense of giving immediate feedback. So the mini-CX, the mini clinical examination tool, is the one which gives the provision for immediate feedback. You've got the case-based discussions as well. And going back to the previous gentleman's point as well. This is where professional behaviour can be assessed and recorded as well. So if there are lapses in judgment, if there are communication encounter difficulties, if there are other things, those things for immediate feedback is really important to drive sort of, the learning, as well as having an evidence to talk to individuals about, because sometimes you pick these things up by hearsay. The nurses say, oh, this person did this thing wrong or whatever, but you've not got an assessment tool to assess, whereas I think the workplace-based assessments gives that added value. So I think if you're not already using it, I definitely recommend it. And I'll talk a bit more about it in our second half as well. But thank you so much for sharing. It's useful for me to know what tools you're already using and what could be added or improved as well. Thank you.
Thank you, Mumtaz. Dr. Amal Swaidan, please go ahead.
Assalamu alaikum jami'an. Thank you, Dr. Hilal, Dr. Omnia, and Dr. Patel for this presentation. I just wanted to reply to the point raised by Dr. Muhammad Umar, which is very important. The college may consider the efforts related to formative assessment. This is the time, the material, the human resources, as well as the importance of formative examination. It is a valuable way to evaluate the whole teaching learning process. It is not something limited, neither it is something limited or easy. So they have to make it clear to the students that attending the formative assessment is something, let's say, mandatory, just like any other activity. And it is not necessarily the mark they put for a formative examination. They can at least consider the attendance. We know many colleges use some evaluation for the attendance of students. By this way, the whole group of students must attend formative examination. Otherwise, the college or the teaching staff will not get a true evaluation of the teaching learning process, because the majority is missing, or significant number is missing, is not attending. Thank you very much.
Thank you, Dr. Amal. Dr. Omnia, I think you have disconnected and returned back. We have a few minutes, I think 7 minutes. Can we hear from the student perspective view about assessment? It's very essential to hear about that. Omnia, can you elaborate, or any other undergraduate medical students, colleagues with us? Omnia, can you elaborate on that?
Yeah, yes. Thank you so much, Dr. Hilal and Dr. Mumtaz. Before this, Dr. Mumtaz, please, I have a question, but I disconnected, so I didn't raise my hand. So I have a question about the importance of feedback and the ownership of students' feedback and the importance of it, and help them learn. So we all know that we learn differently, and each person learn at their own pace. So I want a practical tips about the how to make the students responsible about their own feedback. Because, like, for example, I'm a final year medical student, and a few days ago I had my orthopedic exam. So in my college, we take orthopedic over 2 years, the 5th and the 6th. So during the 5th year, I did like bad in orthopedic. So I used to go and take feedback from my peer students and peer colleagues, and like know their experience with the orthopedic course and how they did well in it, what are the problems and what are the goods about it. So, and then reflected back on my experience. So I had it so changed in my learning and in my performance, especially in the exam. So I want to know how to make this a solid and sound thing for our students, to make them learn. So where the students can come to participate in this, and where the institute or where the teachers can help in promoting this. So if you can elaborate more about these.
Yes, no, that's a really important point, isn't it? And we want to drive the students to learn and, kind of support their own learning, exactly how you've demonstrated, but it shouldn't be all completely down to yourself. So again, how we give feedback is really important. So if you didn't do so well at your first orthopedic placement, why was that and why did that happen? And again, that should be an open conversation that you should be able to have after your assessment. And then, as I said, it's kind of finding out where you are, where the gaps were in learning. And you did that all yourself, which was brilliant. But the supervisor or your tutor, you can tell me how the system works there for you, should be able to go through some aspects of that with you to work out where the gap is, why it is, and what bits you need to do and how we can support you as your trainers to meet that gap. So I think the system that needs to be in place is that, sort of soon after feedback, after your, mainly both your formative as well as your summative exams, and then identify what bits went well, what could have been different, how you could have improved, and then help you drive that process. And we have a learning agreement here in the UK. I'm sure you have too, of similar things to get our students and our trainees to say that we've signed up to do this course, we are doing this, we'll do the regular sort of bits of assessment and we'll attend all those things. So that's how you kind of drive that learning and that discipline to make sure that you're driving that learning and helping along. But would you have supervisors? How does it work in your clinical placements? Do you have academic advisors or tutors, and how could they better support? Because that may be something for us to consider and work through.
Thank you so much, Dr. Mumtaz, for the beautiful insights. So regarding our system of assessment, I'd like to welcome Dr. Naseem. Dr. Naseem is the representative of the final year medical student at Baghdad Medical College. So Dr. Naseem, kindly, if you can elaborate on the assessment methods that we use in our college, please.
All right. Thank you, Omnia, for the presentation. And thank you, Dr. Mumtaz and Dr. Hilal. Regarding the assessment tools that we use the formative assessment during the course. Its purpose is clear. We want to know how the student is progressing through the course. Is he reaching the goals of the course? And also at the end of the course, we use both, I'll talk as a final year medical student, we use a combination of assessment tools. We use long and short case, in addition to OSCEs and oral examinations. So we have some imperfections in this system. Sometimes, in long cases, luck may get involved in this process. Like you could have a difficult case, you could have some assessors that focus on certain aspects that were not clearly elaborated during the clinical rotations. Overall, I think we should focus more on the OSCEs. I'd also like to ask a specific question. Dr. Mumtaz, do you think that using 100% of the clinical examinations as OSCEs is more useful than a combination, or do you think the combination is better in the assessment of the students? Thank you.
Oh, thank you so much for sharing that. That's really helpful, Naseem. So I think a combination is better, because I always say no one exam can assess all the skills. And although in an OSCE, you are assessing and testing different stations and skills, but even in the UK, we have our, kind of the formative, summative OSCEs, but then we have progress tests, and then we have end of year exams and things as well. So still quite a bit of written things. But in addition to that, as one of your colleagues was mentioning, we now have our short cases, long cases on a portfolio, which is more of the regular assessment. So my short answer is multiple assessment tools are better than just one kind of final exam. And because things can change, I always say that, we could all have a bad day. So you can't put all your eggs in one basket. So it's nice to have a combination of assessment tools at different times to allow the best chance for our students to progress as well.
Thank you very much, Mumtaz. Can you go ahead, Omnia, and complete? We have a question from Dr. Mustafa.
Hello, thank you, Dr. Hilal, for the brilliant course. Thank you, Omnia, Dr. Patel. I want to introduce myself. I am Mustafa Hussein Ajlan, a junior doctor from Iraq, external lecturer in internal medicine at the University of Baghdad, and currently doing master's degree in clinical education at the University of Leicester. Very interesting subject, very interesting topics to cover in this session with Dr. Hilal and Dr. Patel. I have actually a question regarding the oral assessments in the era of objectivity of the 21st century. Is there any role remaining for those oral assessments in medical schools? Because as far as I know, they are still running in our medical schools in Iraq. And a second question about sequential testing in OSCEs. As I know that in UK, there is most of the universities running 2 sequences, sequence 1, sequence 2, for assessment of their medical students. How can we apply that to our medical schools in Iraq? Thank you very much.
Thank you, Mustafa. That's really helpful. And I'd love to hear about your medical education degree and things as well, and your course. So with regards to the first question, the oral examination, or the viva, as we used to call it, it's certainly in the undergraduate exams, we don't use it at all. So, you know, they would have the OSCE stations, but they wouldn't have a formal viva. Now, I remember having pathology and various exams as a viva, going into a room and being questioned, which was terrible, but it certainly doesn't happen now. The only places where a viva is used is in some postgraduate kind of settings, either postgraduate exams, but again, the exams like our postgraduate exams like PACES are also done as stations. And also in the like PhD, when I had my viva for my PhD, that was an oral exam. But I think because there's so much subjectivity, you don't know what's being tested, you're not sure whether it's going to be fair. In that setting, I think it's something that we certainly don't use. And your second question was around the cycles. So the cycles is something for the OSCEs that does work here quite well. And I would certainly sort of suggest that that would be a good recommendation for all schools to follow. But sometimes it's more logistics and practicalities of how those things are put into place. So even like simple things like space, number of students, sort of that you're testing, as well as the manpower to run it, makes it more challenging to do. So it's more practical obstacles which negate it. But I think it's a good thing to do if people were able. I hope that helps, Mustafa.
Thank you very much. That was very insightful. Thank you.
Thank you so much, everyone. Thank you so much, Dr. Mumtaz, for the beautiful presentation. I'm very much excited for the second part. So for now, we will be having a 10 minutes break, and we will be back at 9:18. See you.
Thank you.